Welcome to The Whole View. I'm Stacey Toth. Oh, let me just make sure. Yep, we're recording. Okay. Welcome to The Whole View. I'm Stacey Toth of Real Everything. I'm here each week to dive deeper into how we can find happiness and health inside and out through self-love, body positivity, and discovering new ways to be our best selves. Before we get started, a reminder that this podcast is for general educational purposes and is not intended to diagnose, advise, or treat any physical or mental illness. We always recommend that you see a licensed health professional accordingly. And I have one on the show today. Patrick Alonso is your Tampa healthcare advocate. He helps patients navigate the complex healthcare system to achieve concrete health improvements through a holistic approach, which is a crossroads we'll be diving into today, and has an extensive track record of reducing medications and improving A1C levels in diabetic patients. In addition, Patrick has carved a niche in Alzheimer's and dementia care with patients to improve cognition and slowing the progress of degenerative diseases through medication supplementation and lifestyle modification. By educating and empowering his clients, and now you, regarding health, Patrick has so far been able to provide support and assistance and alleviate the burdens that many experience in the healthcare system. And I'm excited, Patrick, for you to empower our listeners today with a lot of the information we're going to talk about. Can you tell us a little bit more about yourself?
Sure, Stacey. So first of all, thank you for having me and thank all of you out there for listening. I just greatly appreciate the audience, and it's so much fun to talk about health and wellness and different modalities that people might not be aware of. So with that being said, like you said, I'm a licensed consultant pharmacist here in the state of Florida, and that basically means it's additional education. So you have licensed pharmacists and then you have a consultant pharmacist. So it's extra education on top of that, with a real focus on deprescribing. So I'm the pharmacist that tries to get you off drugs. And so that is my goal. And then on top of that, I help people navigate the healthcare system. It helps with stress. It helps with all these kind of things. So I'm just here as a resource for my clients to enable them to get through all of the medical speak and the hurdles and everything that kind of happens along the way, and just be their guide. If you go on my website, I have a big lighthouse in the background. So that's what I like to think of myself as or compare myself to.
And you're in the Tampa Bay area, so have just lived through Helene and Milton coming through. And thank you for rearranging your schedule and time and being with us, because I know a lot has been happening in your area. So glad we could get you on the podcast. I want to start by first laying some groundwork, which I think is always important, which is that there is absolutely no shame in needing to take medication. I hear you say that you try to get people off medication, and I think most people would like to not be on medication if it's not needed. And at the same time, if and when it is appropriate, it can be life-changing and life-saving. And I don't want anyone to listen to any show that we have and think, oh, I shouldn't be on this or any of those things, because I think that there is a lot of stigma around needing to take medication that is really unnecessary. And I'm assuming that's part of the work that you're doing, as well as like advocating for what's not needed. Sometimes on the flip side of that coin, people aren't getting the help that they need when there is something that they need, especially, at least from my experience on the holistic wellness side. Oftentimes people will go to the most extremes to try to avoid taking a medication that could really help with their quality of life. And so I'd love if you could share a little bit more about how you approach being a healthcare advocate.
Sure. So, excuse me. So I think that's a great point that you made. I always tell people medications are a tool. You have you have access to so many things in one's like health tool belt, for lack of a better term. So they might have medications, supplementation, nutrition, hydration, their IVs, right? Like different wellness modalities. There are many of them, right? Probably way too many to name on the show in one discussion, but there are many out there, and many are very good. Some aren't so good. Some are studied, some not studied. So there is an element of personal experimentation that kind of comes into everyone's unique health journey. But I agree with you. I don't want anyone to feel stigmatized because they are diagnosed with a disease or an issue and the medication is provided to them. And there are so many great life changing medications that people would not be able to live or have a great quality of life on without. So, the goal as far as being a pharmacist that actively is trying to deprescribe, there is a lifestyle component to that for sure. And that is where someone might find the most difficulty in getting deprescribed. Sometimes there's some really low hanging fruit. Somebody goes to the hospital, they're prescribed a medication upon leaving for 30 days. It just helps them stabilize and be able to go home. But then it just hangs around. And sometimes it just hangs around for years. And it just is a matter of asking, do you need this anymore? Do you use this anymore? Why were you prescribed it in the first place? And you can get to the root cause there. Sometimes, which this is a big kind of no-no, but that's why I'm here to help fix it. And other pharmacists are as well. But it's not always a great idea to take prescription medication to treat a side effect of another medication. And I call that the medication hamster wheel that people will start to get in. So they'll take a medication, it makes their heart rate go up. So then they get prescribed a medication to make their heart rate go down. Now that gives them a headache. Now they're prescribed medication for a headache, right? And so you can see how this turns into someone who just had one issue is now on 5, 6, 7 medications. And so that's really low hanging fruit for me. That's easy work. The lifestyle component, that's a little bit more different because now you have to change someone's maybe thinking, lifelong habits, dietary things, making them less sedentary. So there's a lot more work that goes into that end of deprescribing and creating health, right, than just going after some low hanging fruit, some medications that kind of just get tacked on and left on for whatever reason.
It sounds to me almost like the work that you do with an individual is almost like working with a doula for someone who is pregnant and gonna go through labor, right? You have this advisor that's there with you to guide you, but also it's your own plan. And there are some things that, from a lifestyle factor, some people are going to choose, no, my quality of life will be better if I take a medication because I'm not willing to do whatever an extreme lifestyle thing might be. And on the flip side of that, there might be people who are like, oh, the if I get an air filter in my house that could help my allergens, like things like that, that people might be able to do more easily and willing. And that's part of the plan that they need to work on themselves. I think the thing that's interesting though is that the work that you do is different from what I have always heard are available to individuals, which are advisors provided through either insurance companies or at hospitals themselves. Can you talk a little bit about the difference between those advisors and what you are as an independent advisor, and then also what services would be covered by insurance or not?
Sure. So my practice, it's different. If there are other people in the US that do like healthcare advocacy work and different healthcare professionals, my practice is all concierge cash pay. I don't really deal with insurance. I am currently working on getting a few things approved for insurance, but I just need a little bit more time to document my data and proof in order to submit. So that's on hold right now. I'm just going to leave that off. But the difference between me, I'm an independent, I'm just my own entity here. And the difference between me and then someone who is provided to them through the insurance company or through the hospital is I work for the patient or the client. I do not work for the insurance company or the hospital. So you can see where there at times can be a conflict of interest there. Now, while the hospital advocate or the insurance advocate might be free or cheap, I'm not unaffordable. I have plans for everybody, but when it's free or like very, very low expense or covered by insurance, that's okay, but they're still working for the entity that you were combating against. I don't know if that's a great word for it, or trying to advocate for yourself. And so I am able to come in, give a outside look, as a healthcare professional. More so, I help ask questions to like what would expedite a certain therapy. How are we going to get somebody out of the hospital sooner? I'm a huge fan of getting people out of the hospital. Just people deteriorate in the hospital. It's not hospital acquired infections and all that kind of stuff can happen in there. So the quicker somebody can get out and back on their feet is something that's important to me. And then also, as far as insurance company goes, like they tell, and this is a big difference between cash pay and insurance, right? So if someone decides to go cash pay, like my physician is cash pay, I pay them. This is me being a bad patient, but I get to guide where my treatment is going to go. If I need a medication, I can tell them I would like you to prescribe me this medication specifically because I know I did genetic testing or I know why this is going to work for me better. You go to insurance, right? You have a company or an organization designing and telling you what treatment you will receive over the course of some type of therapy. So those are two major differences. Yours is guided, insurance guides you, and they both have their advantages and disadvantages. I'm not knocking either one of them, but in the sense of just being more informed, some people really like cash pay. They pay a fee like $50 a month. They go see a concierge doctor and they get what's really interesting is they get that more than 10 to 15 minutes that they might see seeing a regular doctor on the insurance, right? So a lot of people go see a doctor. They're in there for 10, 15 minutes. Hey, how you doing? Let's check your labs, give you a rundown. Got any questions, prescriptions, whatever, and they're out the door. Cash pay, they spend time. I spend a lot of time with my clients, like hours, right? Making sure that all their questions are answered, all their needs are met. And those are probably the two biggest differences is that I'm not constrained by anything, whereas people who are employed by a hospital, employed by an insurance company, there are constraints and there are boundaries that they have to abide by, where there are, for me, professional boundaries I need to abide by. I have a lot more wiggle room. I have a lot more ability to ask more questions and guide my client's therapy according to what I know and what my client knows will give them the best outcome.
It's been quite a journey for our family we have now adopted a child, but they were in foster care with us through 4 years, and so now we can put them on our private insurance, but I think there's even a difference between the place or the type of service that someone might be getting, and there was no option for us to avoid state requirements when it came to the requirements for modalities or before someone is prescribed medication that their doctor knows that they need to jump through 8 different hoops before they can get there or different kinds of things. And I think that speaks a lot to the system that we're in and insurances often being for profit or being limited because of funding and these kinds of things. And I wish that people had more access for concierge or for cash. For my family of 6, that's not an option for us, right? Like, so I think when we're talking about being able to work with someone who could, the way I see it, be a go-between almost, right? Like I'm within this system. I am within the normal insurance hamster wheel. But also, I'm very aware that there are factors that impact the well-being of myself and my family, and working with someone who could speak language that maybe I don't speak well, right, but can help me translate or navigate that system seems like a really great, opportunity, especially for a lot of people who I've spoken to whose children are younger or who they're helping with their parents. Oftentimes, those are the 2 situations that make it even more difficult because you've got emotions involved. It's not your body, so it's harder to understand and be able to go to someone like yourself and say, like, "This is the situation that we're in. These are the limitations that we have. We're not comfortable with this thing that's been recommended. Can you help us?" Like, having someone who can advocate or empower you seems like what a lot of us are, like, wishing we could have, right? Like, "What am I supposed to do?" That kind of thing.
Right. And I will say to your point, and I'm honing it in a little bit more, is that 95% of my clients, and there's a 5% of just some people that want a little extra. They're already healthy. They want to like optimize their testosterone or their sleep or something like that. It's a very small percentage of my client, and I love working with them, but I really like the vulnerable populations. I like the pediatrics scare me a little bit just because it's so different. Kids, their metabolism is so much different. The accessibility to certain medications and treatments is very different than adults. So I get a little scared, but that kind of gets me doing more research and really diving in more when I need to help. But I have pediatric patients and they're just great families. And then most of my clients, I would say the other 75 to 80% are 60 and up. And those are generally the people that I can help the most. I believe last time I saw a statistic, I think it was like 30 some percent of Americans age 50 and older are on 4 or more medications, right? And so it's just showing that as people get older and being an advocate and seeing how kids are treated and how older adults are treated, there is a huge, huge, huge discrepancy. Kids, they're a lot more providers are maybe even more nervous to put a kid on a medication because the risks of the adverse reaction. And it's from a legal perspective, it's a little easier to prove medical malpractice and things like that. And it has the potential of tearing a family apart, right? Losing a child or something or harming a child. And then you have the other end where it's like, well, they're old, just tack it on. I'm not exaggerating when that is the reality. Is someone's, well, they're 65. Well, they have this issue. They have this issue. And it's so much easier for doctors to prescribe medications or prescribers to prescribe medications to them or to offer them treatments. It's more accessible, but it's also, when you look at like how the guidelines are written for treatment, there are a lot less children that are in need of treatment than older adults, right? So there's a less population to study when you're studying children. So there's a lot more treatments that are just unknown, and it's like kind of unethical to experiment on children, right? So these are the reasons why some of the reasons why there's such a discrepancy. Now you look at older adults get different treatments all the time. They can enroll themselves into clinical trials. There's a lot more things that can go into their treatment. And that's why there's such more of a large population size. And when I'm talking about pediatrics, generally, off the top of my head, most of them have like some kind of genetic issue or were born with something. And so we're not talking about what would be perceived as a normal, healthy child. There's some issue. And then when you talk about adults, like, yeah, they were healthy maybe at one point in time, and maybe age has caught up to them or lifestyle's caught up to them or something has caught up. And it's just a lot easier for prescribers to just chalk something up to old age and write them a prescription, and then they're out the door. And that's where I feel like there's a huge discrepancy in care, even by younger adults in their 20s, 30s, 40s, where there's maybe less reason to start them on a medication or offer a treatment. But I just see so much as far as with the elderly, and then it's so much more easy they get scammed a lot more. They're so much more vulnerable because of various reasons. And so I like to step in and help them. I had a really close relationship with my grandparents. My mom and dad went through a really bad divorce when I was a kid, and my grandparents picked up the slack for a while, and I'm super grateful for them. And I actually started this business because of my past encounters with my grandparents' healthcare. My grandfather was prescribed duplicate medication from 2 different prescribers that weren't in the same network and didn't speak to each other. And we didn't know this is before pharmacy and all that. We didn't know. Just like, okay, yeah, the doctor's right. And they were, right? But they didn't know about each other. So there was harm done. He went to the hospital for that. My grandmother, kind of very similar situation where she had a stroke and was prescribed too much blood thinners and had a bleed issue. Luckily, she survived. But it's so easy with the way the system is, and I'm not attacking providers or doctors or anything. I think people who go to school or get education and training and want to go and do something good, I think a lot of these people really have good intentions in their heart. I think the system that they have to exist in makes it very difficult. It also makes it very difficult to leave with the golden handcuffs. They're paid well, so it's very tough sometimes to get in. Like people go to medical school or they go to pharmacy school and they're like, wow, this is going to be great. I'm going to make a huge difference. And then it's like insurance, Medicare, right? Now I got to play by rules. So there's a certain point where you have to take that education and training and you have to fit it into the system that you're working in.
Yeah.
And there's a lot of doctors that are leaving. There's a lot of doctors that are leaving insurance because they feel like they can't practice the way that they want to practice. And that was one of the reasons why I left traditional pharmacy, because I felt like I was contributing to a problem. I was answering the same questions over and over again. And I just felt like I could contribute so much more doing kind of what I did for my grandparents, except now with an advanced degree and skill set and knowledge, that now I can do so much more for those people and be an intervention before someone gets hurt.
I think that it's important to highlight what you said, that I think everyone goes in wanting to help people. And I would argue even that the systems and the regulations that are set up are coming from a good intention of ensuring what is perceived to be optimum outcome. And I think where we've come as a society is not that intention, right? Like it has played out in a way that is not serving people well. And so it forces us to be our own Dr. Google and these kinds of things, which are also not ideal. So when we're talking about the services that someone like yourself might offer or different kinds of things, I encourage people to ensure that if you are working with a health coach of some kind, that they are certified and licensed and have education. We've talked about that before on the show. There are a lot of people out there providing health coach services to capitalize on this need that are not educated and could create even more concerns in my mind. But when it comes to where I think we are now, what I hear most often, and frankly is difficult to navigate in my own life, whether it be with myself or my family, is this idea that we can both focus on lifestyle and take advantage of modern medicine. And where the line is delineated is super difficult because most people, so for example, let's take perimenopause, right? Like we is the common topic in society right now. It's something that I'm personally going through. I know a lot of listeners are. And so there's a lot of symptoms associated with that are not pleasant. And there are lifestyle factors that can help. And the question often comes in, where is the line of quality life of the things that I'm doing to help my health and minimize my symptoms as much as I can? But if I'm still having hot flashes, if I'm not getting a good night's sleep, if I'm feeling moods shifts that I don't want to be snapping at people or different kinds of things like that, when then do I decide hormone replacement therapy might be for me or different other kinds of prescription medication? And I think that example can be applied to a lot of different things. I know for me, when the kids were younger, it was very similar with ADD, ADHD. Like, what can I do lifestyle wise? But I want my children to be able to pay attention and to learn in school and to not struggle, right? Like, there's always this line that we have where we want to help, we want to lean into lifestyle. And for quality of life purposes, sometimes if you just can't get there, when do you decide or how do you know that it's the right time to then seek medical medicine approach?
That's a really fantastic question. I don't think I've been asked that so directly before. Usually, like, we get around to it eventually. So I appreciate that. Well, so first of all, like for your example with perimenopause, right? I have a little bit of a background in compounding. I work PRN at a compounding pharmacy here in Tampa. And so I've had the ability to learn quite a bit about compounded medications and hormone replacement therapy. and things like that. And I think that perimenopause and menopause got a bad rap years ago with a lot of doctors saying like, oh, estrogen and progesterone and testosterone, all these, they're going to cause cancer, all this. And right. But they're actually showing that over time, if a woman gets on HRT or like modifies lifestyle, gets on HRT, what happens is that her risk for osteoporosis and osteopenia go way down. The benefits, much more, from my understanding, outweigh the risks of cancer. Hot flashes go away. A lot of these symptoms go away. And I think it's important to realize that, and this is like the compounding pharmacist in me coming out, that a little bit of testosterone for the ladies is actually really good. Now, everybody's dose dependent. I'm not going to throw doses out here, but everybody, like men we make a little bit of estrogen, women make a little bit of testosterone. So when we're thinking of like full HRT, sometimes it's better to go compound route because you can really individualize that treatment. But back to modifying lifestyle and things like that. So always educate yourself, right? Like that's the first kind of step. And there's a lot of great resources out there. I think that sometimes when I'm, as a healthcare professional, when I'm dealing with an issue that's very niche or very unique to one person, I'll go online and I'll look through case studies. Like I'll try to find some case studies here and there on different websites. And sometimes the websites aren't super credible, but you can get an idea of where, if people are finding solutions to problems based on like a supplement that they take or a medication that they got or something, a lifestyle intervention that they made, there might be something to it, maybe not. But if you start to see case studies of maybe you see like 10 women who have been like, hey, I found the solution for hot flashes in perimenopause and menopause. And you start to see that in those 10 women, 8 of them used the same supplement or got the same amount of sleep or did something, then you can really hone in your search to a much more well-studied, more credible, evidence-based area. And unfortunately, there isn't like large populations of people willing to volunteer themselves for these studies, number one. Number two, who's going to pay for it, right? Like big pharma pays for their drug studies. There's funding there, there's research, and they can drive that force. People aren't necessarily going to pay for studying the benefits of tomatoes and celery, right? So like that's something that people probably, if they haven't thought about it, probably should think about. Is like, who is paying for these studies and who is like giving this actionable solution? And what are the other things that maybe people have found that work for them? And if you start seeing like maybe not large populations, but nice sized populations of people that are finding solution, that's a great way to hone in on a solution. They don't always work. It's not always evidence-based. It's not always studied. But if someone's willing to go that route and try it, sometimes it can't hurt. The area of where people feel like they've made the lifestyle interventions, like let's say they've done all the research they can, I don't ever advise someone to just start taking like 100 supplements because A, you might not know which one is actually working if something works. B, they can interact with medications or interact with each other. So, and C, like sometimes people are just wasting a ton of money on 100 supplements and they might not be getting the benefit from it.
Well, and
So once they've,
I would also argue that when you were saying like it doesn't hurt to try, sometimes it can hurt to try. There's a lot of problems with supplements that are not actually tested or clinically studied. And so I always tell listeners, if you're going to take a supplement, you need to be checking the sources on who's making the supplement and are they making sure that what they say is on the label is actually in it and that it's effective in those things. Because I just recently shared about a whole line of supplements that had contamination with shards of metal in them, and people were
Mhm.
having extreme problems. And then there was another recall that the FDA can't mandate where company had put a different ingredient in the supplement than what was on the label. And that particular ingredient was a toxic, harmful substance instead of the one that was supposed to be in it, right? And things that we would think aren't allowed in the States are allowed with supplements. Like medicines are regulated. That's not going to be
Sure.
something that you have. But I think on the topic of supplement, I always want to make sure that people are aware of those things because the oversight and the regulation on that is not what I think most people would think that it would be.
Yeah, that's a great point. Supplements are not FDA regulated. Whenever I'm telling someone to go out and look for a supplement, I don't ever really recommend brands. I want what works for them. I say make sure it's made in a good manufacturing practices facility so it'll have the CGMP stamp. You want the USP label, United States Pharmacopoeia, or the NSF label. And those are and also third party tested. If they can provide that information and willing to be transparent about it, chances are you have a better product than a company that's not willing to do those things or go that extra mile for their customers. What I meant by it doesn't hurt to try sometimes is exactly to your point. Sometimes, yes, it can hurt to try, but sometimes solutions can be relatively benign, right? Like some people get a great benefit out of vitamin C if they're not getting enough in their diet. It's really hard to overdose on it. You know what I mean? It's just one of those things. So that was like my train of thought. But as far as getting someone to, okay, I've made all the lifestyle interventions I can possibly make or think of or research or ask about all that, and it's still not enough. There has to be a point where somebody can say, well, this is really hurting my quality of life. I don't feel good every day. I don't feel like I used to 5 years ago. Then it might be a good idea to go inquire about some type of therapy. One thing that I tell a lot of people that I think a lot of people don't think about is like this inherent stress that a lot of us live with. Like most people live with just a ton of stress, whether it be financial, work, family, any of those kind of hurricanes, right? Like there's just a ton of stress, especially on us here in the States. Like you look at other countries, I have family in Spain, they take a nap in like the afternoon. That would be unheard of here, right? So there's like certain stress induced causes that really throw off our endocrine system and our hormones. And if we're constantly living in this state of cortisol, which is the stress hormone, it will slowly but surely shut down a lot of our other hormones. So for men, testosterone production, thyroid production; for women, estrogen and progesterone. And I have seen and heard of women going into menopause early in their late 30s because they work like a high stress job. They're maybe a high powered attorney in a firm, or a doctor that sees a ton of patients a day, or someone who just has a big family and they're the major caregiver, things like that. And that constant state of cortisol is really just shutting everything down. Our body, for the most part, acts on what we call a negative feedback loop. So it produces a hormone, it produces another hormone, and then when there's enough of those hormones, it tells the other signalers to stop, right? And shut down one of those areas, and then hormone can either be overproduced or underproduced and things like that. So it's important. I think talking to people about managing stress, I don't know how much you've discussed it on your podcast. I'm sure you have. It's a huge topic that I think gets just a fraction of the attention that it really should get.
No,
But
I'm glad you brought it up because I tell people that cortisol, there's no point in looking at anything else related to what you've got going on hormonally, inflammation wise, all of those things if your cortisol is dysregulated because it could be the cause of those things. And for me, it took quitting alcohol and caffeine to regulate my cortisol. And whenever I tell anybody that I don't drink caffeine and alcohol, it's just like the blood drains from their face and they're like, my goodness. I make a joke. I'm like, yeah, I'm great. I'm a good time at a party kind of thing. But actually I am fun at a party. And then I wake up and I don't have a hangover, right? Like it's
right,
once you're past the curve of it, it's hard to do. But then once you're on the other side of it, it's amazing. And my my metrics of health improved so much once my cortisol was regulated. And I do take supplements that have helped finally my inflammation, I have multiple autoimmune diseases and different things, and it's really hard for me to get my inflammation regulated. And finally, for the first time since I've ever been checking it, my inflammation is within a normal range, my cortisol's within a normal range, and now I know if my hormones as they relate to women's health and perimenopause go askew, I can say that's related to perimenopause, that those kinds of things versus, oh, I need to address these other things first. And I think that's where it's really difficult when you're on multiple medications, or I would argue that alcohol and caffeine are people self-medicating for stress and for overworking themselves and those kinds of things. And so if we can't peel back and get to a base layer, it's really hard to identify your own root cause of at least in my experience, right? Like I couldn't identify really where the root cause was if I had all these other things that were going on. And I think that's where you were talking about you get onto a hamster wheel because then you start treating like this one thing, but that doesn't solve it because that wasn't really the root, right? You're addressing like the symptoms as they come up versus the root. And I know that not everybody is willing to do that from a lifestyle factor, which is where I think this question of when do you decide what you're going to address, like as much as you can do lifestyle wise, and that looks different for everybody versus going the path of medicating.
Yeah, and I agree with you. I actually quit drinking, I don't know, probably like 3 years ago. And, like, it's crazy, like, my face is not as puffy, I stopped doing stupid things, like, it's just nuts. I don't have hangovers anymore, which is incredible.
For me, it's a lot more like anxiety,
Right,
inflammation.
right, and I'm sure that my body was extremely inflamed with just as, like, how puffy I was when I was drinking. I have a history of addiction in my family, so there's a lot of, like, really good reasons that I stopped. It just wasn't for me anymore, and I'll even say it was at the Daytona 500 a couple years ago. I just, like, the night before, we went out drinking, and I didn't feel like I got, like, had that much to drink, but just the next day, I woke up so hungover that I was like, "I'm never doing this to myself again. It hurts." I couldn't drink water in the morning. It was just awful. So, I do like my good cup of coffee in the morning, but I do know exactly what you mean as far as quitting coffee. Just it's a good idea to wait, if somebody does like drinking coffee, to wait a little bit after they wake up, because cortisol actually wakes us up in the morning, right? So you're asleep and that cortisol starts pumping a little bit and that just wakes us up. If we drink coffee right after we wake up, it just maintains that cortisol level throughout the day, where naturally, if we woke up, we did our morning routine, got to work, or had a couple hours in between waking up and the coffee, that cortisol drops and it's less of a stressor on the body than just intaking coffee right when someone wakes up.
Yeah. Hydration and food for sure. I
Mhm.
recommend to people beforehand, which again can be really difficult. I'm not trying to minimize that, but when we're talking about lifestyle factors, you were mentioning, and I was like, I can be the first to tell you, like, I have been doing lifestyle factors for 15 years, and I nitpicked every single small crumb of food that I put into my mouth. I was obsessed about so many things, and meanwhile, I was putting carcinogenic alcohol in my body. I was increasing my cortisol was really dysregulated, all of these kinds of things. And I think the stress that I put myself in with being so obsessed with the food actually made things worse for me, but I was convinced that it was helping. And so this is where I think from my own perspective, I want to encourage listeners to know where your line is, right? Like before you start tweaking with a bunch of lifestyle factors, because I think sometimes you can be like, well, I'm pot committed on this thing. I'm going to try the next one and try the next one and try the next one. And I think sometimes it can keep us from, for example, if you're experiencing a lot of anxiety and you start to go down all these paths, another topic we've talked about on the show, right, maybe just a small amount of anti-anxiety medication for a short amount of time will actually help regulate things for you. You can not be so worried about the foods and the other things in your life, and then it's easier to kind of transition off and into something else. But I think it's really hard to see that if you're fighting so hard for the thing that you want and you've been fighting for it for a really long time. And then all of a sudden you're years in and you've been battling this thing that hasn't gone away when a medication could help. And I think that's probably the opposite of what you're used to. But I think for a lot of the listeners who have been in like this health and wellness journey, we have to consider that as much as we consider, okay, I've been on a medication or I'm taking multiple medications because of the side effects and I want to get off of that. Both of them are just as valid in terms of taking care of our bodies. And I know for a lot of my middle-aged and older listeners, I don't wanna say elderly. You said elderly, and I just wanna call out, I don't think that's fair. Let's say my golden aged listeners,
That's fair.
um, I know that a lot of things naturally will happen, right? Like, cholesterol is more likely to increase. Blood sugar is more likely to be dysregulated. Like, there are just some things that are more likely to happen as we get older. You mentioned bone loss, right? Like, these factors exist, and so I think having a plan of, "I'm gonna do these things lifestyle-wise, and I'm gonna do the best that I can," up to what point do I decide? A year? I'm gonna give myself that amount of time for my body to adjust and to de-stress and to get better sleep and to because this stuff takes time. Re-regulating your cortisol is not something that happens overnight.
Right.
Like, you and I'm sure as you've worked with patients on A1C, for example, right? Like, that's not something that just happens overnight. It takes time for some of that stuff. So, give yourself time, and then if it hasn't, I just feel very strongly like you've got to tell yourself it's okay to take the medication and you can continue to do the lifestyle work. You're probably going to take less medication. You're probably going to need less medication and these kinds of things and like feel good about that and continue to do the work and maybe eventually you come off of it. But I worry about people who avoid that because they think that it makes them bad or that they're not lifestyling hard enough. And sometimes,
There are certain points where a health goal or something may not be obtainable for whatever reason. And another way I like to look at medications is, and we can talk about diabetes and blood pressure. That's pretty easy to talk about. I think everybody probably knows somebody who's dealing with one of those two things at some point in time of their life. So it's relatable. But having high blood pressure or having high A1C or blood sugar increases the risk of heart attack, stroke, vascular complications, all that stuff. So if someone finds themselves in a situation, and this is going back to there's no shame in taking medication, when someone is prescribed that medication, those medications actually help lower the numbers, right? But puts them in a safe place to make the lifestyle modification, where if they didn't have the medication before, they would be doing lifestyle. It may or may not be working. Blood pressure, blood sugar still might be high. And now they're at a risk for stroke, heart attack, vascular complications, things like that. Where if someone can take the medication, use it as a tool, like I said at the beginning of our discussion, to get them safe, then they can experiment with lifestyle intervention. And that is where now they're lifestyling safely. And and I mean, in my experience, I don't know everyone's experience, but in my experience as a pharmacist and an advocate, I get all my clients, I say, hey, okay, we're going to make this change, right? Like I'll just say my diabetes patients who have gotten off almost all or all of their diabetes medication. There are some things that we have to do. We have to track blood pressure at least twice a day, morning and night. You want to do it 3 in the afternoon? Cool, right? We're going to do our blood pressure appropriately. We're going to take it. We're going to put the cuff on our left arm. We're going to sit still for 5 minutes and relax and breathe deeply through our nose before we hit the button on that machine, right? So there's protocols that go into this. We can monitor blood sugar. Now, if it's an extreme case of diabetes, there's probably a lot more monitoring that goes into someone with an A1C of like 6 or 6.5, right? And so it might not be worth pricking their finger all the time, but maybe just seeing how they feel, documenting if they're getting headaches, if they're feeling lightheaded, if they're having any type of bouts with hypoglycemia, sweating, dizziness, things like that. How much do they go to their sugar kind of reserve? So what I mean by that is if they're feeling a bout of hypoglycemia, do they reach for the soda? Do they reach for the piece of candy, the juice, things like that to re-regulate their system? How often is that happening? And once they start documenting those, they're taking the medications, hopefully as prescribed. We can track the data, and now it's very easy to lobby for someone to say, "Hey, I think a lower dose here is appropriate." Right? So doing that personal tracking, and I think that's where a lot of people get very frustrated because it is a lot of extra work, right? Like to go take your blood pressure 2, 3 times a day is, if we did it the right way, it's probably an extra 20 to 30 minutes out of your day. Monitoring blood sugar, finger pricks, they suck. Let's be real. So there are aspects of it that aren't great, but with that end goal in mind, and right there, they're also in a neat way, which I saw with like one of my first clients. And I was like, "Hey man, I think I can reverse your diabetes. Let's try it." He had a lot of low hanging fruit there too, right? Like very overt low hanging fruit. Getting him to take this kind of accountability step was a struggle, but once he did, he had this whole documented journey, which was actually really cool to see after 9 months when the A1C really started to we saw a profound lowering, no bouts of hypoglycemia after like the first month, and the ones he had weren't very severe, but just this like really cool journey. Look, and he's looking back on it. He's like, look at how my blood pressure normalized. This is like an 80-some-year-old man now, and his blood pressure is like 121 over 80. He's got like great blood pressure, and his blood sugar, I think after I think the second A1C reading, he was like, I haven't had an A1C below 7 in 10 years. So he's sitting at the doctor's office shocked. He's looking at me like, holy crap, this is working. And it was so cool because we could flip through his little books and he has all this stuff documented, and he could go back and see how far he came from the start of like just feeling like crap all the time, not wanting to do anything, just wanting to sit around, and it just wasn't a great quality of life. And now he's up, he's walking, he walks every day. I go for walks with him sometimes. Like this is just the journey that this guy has made is so great. And anytime he feels like it's not going the way he wants to, or he's had a shakeup of health, or he had a hospital stay or something, he goes back to those little books and he goes, look how far I've come. And he did that like in his 80s. So I think that to a degree, anybody can do it. You're never too old to start. And what I will say is like 100% of the time, making at least some lifestyle changes, even if they still have to take medication, they still feel better. Their quality of life improves. Playing with your grandkids, they're more willing. What I've seen too with older adults too is that they become more willing to learn, right? And they just get so much more excited, and it's so neat to watch them get reinvigorated with like, oh wow, I have this whole world now that I didn't have 2 years ago.
I think it's interesting. I heard Peter Attia give a talk about uh, your physical age versus your biological age, or he has like two words for it, right? And I think that individual that you worked with went from being older than he was to being younger than he
Mm-hmm.
is when you're able to regain your health. And I think that the story of it being both he was seeking medical treatment and care and he was working on lifestyle is really important because he was able to reduce his medication, but he was still taking it to have that safe approach. I like the way you described that. So I'm curious, is finding an advocate for those of us who are not in Tampa? I would love for you to go on a walk with me. Be like, Stacy, you've been sitting at your desk for 4 hours. It's time to get up and go for a walk.
We can schedule that.
What does it look like for someone to work or to find someone like you if they're not in Tampa?
Sure. So as far as pharmacist advocates go, I know that there is a young lady in Georgia doing her thing, and she's left traditional pharmacy like me and is doing similar work. Other advocates, there's a lot of advocates from what I've seen. I don't think there's enough of us. I think that the healthcare system is very convoluted for a lot of people, and just so overly frustrating that it's very easy for people to just be like, screw it, right? A lot of advocates are nurses or former nurses. I've noticed that. And there are some advocates that they can go through like a schooling program and it teaches them about the healthcare system, wraps it all in. I think the biggest thing, it's like what we've been talking about the whole time. You have to find the advocate that's right for you.
Where
The
does one even do that? How do most of your clients find you?
So I'm at the point now where it's word of mouth and I have a pretty strong Google presence. I know a little bit about SEO and I've worked with some friends and stuff to help increase the presence. Also, I've done some work locally here in Tampa that's gotten me some features on the news and things like that. So I've built a reputation. It takes time, uh, but I think a Google search, call around. There are different advocates all over. I think just starting to search like healthcare partners, healthcare advocates, care coordinators, they go by a bunch of different names. And then just calling I offer a 30-minute consult to anybody, right? Somebody calls me up, hey, here's my issues. And I don't take anybody's money if I don't feel like I can help them or if I don't feel like they're willing to actually take those steps, because sometimes they're tough. So a lot of us usually offer some kind of consultation. It could be 15 minutes, it could be an hour. So things like that. And then I think like if someone sat down just with themselves or maybe with their family or anybody that they make decisions with and say, okay, here is what I perceive is going wrong. And here are what my goals are. And then sitting down and determining what are the steps maybe in between and who might be the right person to kind of work on this stuff with or help coach me or give me accountability or guidance or whatever the case is. I think that is super important. And that's where it's more of a personalized approach. Most of the people contact me they're on a lot of drugs. They want the pharmacist help, right? Where if I was a nurse, that might be a little bit more out of my scope. Nurses know a lot about medications, but it's just a little bit more intimate with pharmacists, right? So while a nurse can lobby for medication deprescribing or different treatment or things like that, it's just the scopes of practice are different. And does somebody just want somebody to hold their hand through the medical system? Do they want to make changes? Do they want to make improvements? These are all things that I think that someone who's looking for an advocate or looking for someone to help them, I think that those are a lot of the questions that they need to ask themselves and then just go talk to people. I've met people that were like, hey, your website popped up first on Google. I called you. I've had people say, I talked to 20 advocates and I just feel like you're a good fit for me because I'm on 17 medications a day. And your reviews and things like that show me that you actually work with people that are in my situation. So we all have our own little niches, I think, and it just depends on what box that person has to fit into.
I like to always leave listeners with something that's positive and actionable that they can take to be of service to work on either for themselves or potentially to help someone around them. Maybe their parents are on a bunch of medications or whatever it might be. I'd love to hear what your idea would be of if someone's listening to this show and they're like, okay, I'm gonna I want to do it, but I don't know where to start. What would that thing be that you would suggest?
Sure. So I'll say the number one thing. I'll say like two different things. The number one thing is like if anybody's out there struggling with sleep and stress for sleep and all that kind of stuff, I personally and a lot of my clients, and there's a lot of evidence for magnesium bisglycinate. I love that supplement. I think that magnesium in our food sources has actually been depleted, soil depletion, whatever, factory farming, all that. I just don't think magnesium shows up as much as it used to. Like when I was a kid, and then even when my grandparents were younger, I remember not explicit in a bad way, but just like specifically talking with my grandfather about food quality from the time that he was younger till the time he was older. So I think that's something to take into account. I think magnesium and zinc are way out of our food sources. Other things, then it's just different where you live in the country and how people are sourcing food. So that's my one. My number two is if anybody's looking to deprescribe medications or get off medications or just find like that appropriate, optimal kind of regimen, it's important to sit down, create a whole list of medications, like anything that they take, including supplements and over the counters, and then go through each one and say, why am I taking this? Right. And if they can remember it, good. If they can't remember why, that might be a good place to start. Well, why was I originally prescribed this? And then dive into that. Well, why and where? Who prescribed it? Are they still practicing? Do I still see them? Did this carry over to from another doc? That's good. Looking for medications that might treat the same thing. So duplicate therapy, which isn't always a bad thing. Sometimes people need two different drugs to treat the same thing. But that's another really great place to look as far as, are these duplicates or do they have a purpose? Dosing, that would be a little tougher. That might be something they can ask. They can just go to their community pharmacist and ask, like, is this dose optimized? Would be a good question to ask. A lot of times I think that someone will go to one prescriber and they'll get a blood pressure medication at a starting dose, and that doesn't necessarily control their blood pressure, but then they go to maybe a cardiologist and then they prescribe a different one. And so they're now on two drugs and neither one of them have been optimized or titrated to effect. That's something to look at. And then just overall asking a question, do I need this anymore? Like what we were talking about earlier, I dealt with this maybe 2 weeks ago with a client where we were discussing her anxiety in the past and up to the present. And we came to the conclusion that one of the medications, she didn't remember where it was prescribed from, and there was a bunch of questions. And we came to the conclusion that she didn't really feel like she needed it anymore. We just, by probing and asking questions and digging for answers, and she was like, well, you know what? I don't feel as anxious now as I did then. So, and then we decided with her prescriber's help, hey, why don't we just cut this dose in half? The drug had a score in it, so you can cut it in half. And for a little bit, she did that. She's like, I'm not really feeling anything from this. I'm not getting the benefit that I was once before. I don't feel as anxious. So we just discontinued it with the doctor's approval. So those are all, I would say, some good tips and tricks to start investigating in someone's own health and medication regimen. And really at the end of the day, like less medication, there's no stigma, or there shouldn't be any stigma to taking medications, but also they can provide benefit, but also getting off some of them, it really helps with cost. That's sometimes how I pay for myself, is like, I'll see a bunch of low hanging fruit and I'll be like, well, if you stop taking this, you paid for me. And then now you can continue to save money in the future. Right. So there are a lot of different ways that it can be attacked. I would not discontinue a medication just based on cost. Like there's other ways sometimes to figure it out, or there's other things that they can do. But everybody has their own factors as to why something is good or bad. And I think they need to sit down and evaluate with themselves and the other people that make decisions with them. And you can find a lot of answers just diving within and seeing what's right. And then my last point, and we talked about it a little bit earlier, so I'll make it really short, is minimizing stress. Take a little bit of time, even if it's 5 minutes. I think 5 minutes a day of meditation, just solitude, breathing through the nose, right, is shown, I think, to reduce Alzheimer's risk by like 80%. Just 5 minutes a day. And it really helps lower blood pressure. It helps normalize stress and cortisol and things like that. So just a good, quick 5-minute meditation, if you can get it in and fit it in, can do wonders for someone's cognition, mental health, and stress levels.
Well, and I love that you started with nutrient sufficiency, because specifically magnesium we use more of when we are stressed. So whether it's related to how much we're getting, or sometimes it doesn't matter like how much you're eating in your food. If you're living a stressful life, your body's going to burn through and you're going to need extra. So one of the things that I always suggest to people before they start supplementing is like do a test to see where your levels are and then start taking supplements and test again. You can do this through doctor like blood tests, but for me, just for over the counter supplements with stuff like that, especially like you said, a lot of these vitamin C you're not overdosing on. It's a little bit different than vitamin D, where you want to make sure your levels are within a certain range. But they have like sticks that you can pee on these days to check these things. And I think a lot of people are probably more dehydrated than they realize as well,
Oh,
right?
yeah.
And so working on adjusting some of this stuff, and a stick would tell you a lot of this information is, as you would call, low hanging fruit, right? Like start with just getting all of those things into a optimized range and then see how you feel, because then, to your point, maybe you're able to look at some of the other stuff you've got going on or are thinking about taking on and being like, "Oh, you know what? Actually, I'm feeling a lot less anxious and overwhelmed because I now have the appropriate amount of magnesium. I'm sleeping better through the night. That makes it easier for me to not be so angry and mood shifty during the day because I got a good night's sleep," right? Like these things really compound upon themselves, and a simple adjustment and just being aware that you're deficient in something can be so big and important and is easy to check. Like these days, Amazon has a quick little like $5 stick you can pee on and then where you are with that stuff. So
Those are great points.
thank you so much for all of your recommendations. I have reached a point in my life where I am personally not on any prescription medication, and I'm really proud of that. And at the same time, I couldn't have gotten here if it hadn't been for medication that I took at the times that I needed it. And so I hope that everyone listening can feel like no matter what situation you're in, you're on the path to your own health and wellness. And that's the most that you can do, right? Like you can do the best that you can with the knowledge that you have at the time. And hopefully you've been inspired and learned a little today, listeners. And if you did enjoy the show, I would love if you could go leave a review. However, you're listening to the show, it costs you nothing, but a few seconds of your time, it makes a big difference. And of course, I want to encourage you to check out and go give a follow to your pharmacist, your advocate, all underscores, or you can find more information about Patrick and his services at tampahealthadvocate.com. Is there anything else you'd like to say before we sign off?
Yeah, so it's an honor to come on your podcast, Stacy, and to provide some education and knowledge to your audience. I think it's I think the world of podcasting is so amazing because you can just convey so much information in kind of a short amount of time and really help lead people, down a positive track of health in this case. So thank you so much for having me. Guys, thanks so much for listening. Guys and gals, thanks so much for listening. I really appreciate the platform to be able to provide some health education.
Well, thank you for being here. And listeners, thank you for listening. And I'll be back again next week.